My interest in medicine started at a really early age. My entire family is in medicine. My dad, my uncles, my grandparents. So at a young age, I knew I wanted to go to medical school. And that came true when I ended up in Cleveland, Ohio at Case Western and Cleveland Clinic, where I did my undergrad, my med school, and internship. And then subsequently, I was interested in radiology, primarily from the diagnostic side. And then in medical school, I had a great experience in stroke intervention. And this was in its early infancy. And a patient was having a stroke on the table. We took the clot out, and all of a sudden restored function, and then her speech came back too. And I said, this is amazing, I have to do this. And so that's what began my journey at that time into radiology, because it was the main pathway to get there. When I started my residency, I got a lot of exposure in diagnostic imaging, learning how to spot abnormalities and trying to figure out what's wrong, and quickly how to figure out how to fix it. My residency led me into Chicago at University of Illinois. There was a neurointerventional radiologist. He was a great guy and a mentor who took me under his wing, and during my residency I was getting additional training in neurointerventional radiology and learning about treatments of brain aneurysms, strokes, fistulas, a lot of which was in its infancy and very early in the field at the time. And so after I finished my neuroradiology fellowship, I did an interventional radiology fellowship to build my skill set in wires and catheters and learning how to do complex procedures in the body. That's where I learned how to really treat complex vascular disease involving the brain, AV malformations, AV fistulas, brain aneurysms, subdural hemorrhages. That's where my schooling has kind of gotten me. So at VIP, what we really are able to offer here is a outpatient service for many of these procedures. Our role is to really act as an advisor and as a consultant to the patient. And that's the best thing that we can do, because patients now have options. And so what I've learned is the skills that I've brought into interventional radiology, I can use in neurointervention and vice versa. And that's provided me a very versatile ability to treat complex AV malformations in the body, as well as complex vascular lesions in the brain that may have previously been considered untreatable or inaccessible, or patients that have said, look, there's nothing that can be done, and then they find someone like me where we can get treatments that can be offered and that work.